I've always been very healthy and taken very good care of myself, and this diagnosis felt like my body had betrayed me.
When I was diagnosed, my whole world just changed. I thought that I was going to be gone in a year.
I thought, this really can't be happening, but I'm going to have to take care of it right away.
And I come in for a routine mammogram, and suddenly I get this diagnosis that just turns my world upside down.
You know, when you get that cancer diagnosis, it's the ultimate wake-up call in anyone's life.
And I know that you think, oh, well, this is a cancer diagnosis, I can't do that. You can.
There are great doctors here for you. There are great complementary treatments. You just need to move through this step by step, day by day. You have strength in you that you don't even imagine.
This is a hard time when you're first diagnosed and you don't know how much treatment you're going to need.
And when I was diagnosed with breast cancer, it was a big emotional shock to me, because it was for the first time that I realized I had absolutely no control.
I know a lot of women, when they get diagnosed with breast cancer, or I think anybody who's diagnosed with cancer, they think, what did I do to cause this?
And if they can just hang in there until we get the facts, then we can tell them this is the program, and then it's just a matter of getting through it and putting check marks on each day's treatment.
Get as much information as you can, trust the system, and there's great people here at Palo Alto Medical, and they'll take care of you.
Your friends, your family, this is the time for you to reach out to them. But as well, we have many resources here at the Palo Alto Medical Foundation. You can reach out to your doctors. We're here for you.
Until you get to that point where you get through all your testing and find out exactly where you are and meet with the doctors you meet with, until you have your game plan, I think that's the worst period of any cancer treatment.
I had to come up a learning curve very quickly. I didn't know anything about breast cancer when I was diagnosed.
When I first heard the word breast cancer, the first thing I thought is that I was going to have my breast removed. I didn't even know that there were other options.
With the resources we have in medicine now, with all of the different ways that we can treat breast cancer, that it really is a very treatable disease.
I didn't tell a lot of people that I had breast cancer, because for me it was a little awkward dealing with their uncomfortableness.
I immediately let everyone know that I had been diagnosed.
I was so devastated when I found out. I just let my mom tell everybody.
The first thing I did was put up this wall of defense. I didn't want to tell anyone. I wasn't going to tell my family, because how could I? I am the person that keeps everything together.
So we told our daughters that I had cancer, and that cancer is a scary word, but in this case, breast cancer is a form of cancer that's very treatable, and I was going to go through a lot of different treatments.
Somebody came into my house and told my wife she had cancer. How was I not going to be angry? I was angry, and I was really unhappy. But not at my wife and not at the person that told us, just that we were facing the situation.
Something told me, said, no, you cannot do this by yourself. It's not about you.
Some of the most difficult issues really are not knowing. It's the unknown. You kind of get the initial talk about what's going on, what might happen, but you really don't know until you meet with the various different doctors that you will be working with.
As an advocate, the first thing you realize is that you have to start small, and I mean with yourself. You have to be an advocate for yourself. You have to be able to, talk to your doctors as an equal and as a partner, one-on-one, and get your needs met.
We are gaining more and more knowledge in breast cancer. It's changing all the time. And so the more knowledge you can get from your clinician or from other resources is again going to impact the best course of treatment for you.
We're here to help facilitate that decision of choosing mastectomy versus primary radiotherapy. And in that setting, most women in general throughout the country would prefer to maintain their breast if the outcome is the same.
I was scared and nervous and worried, and I didn't take in all the information. So we would drive away and I'd say, what did they just tell me?
Being a caregiver is a simple concept. You know, a family member goes into crisis, it's your spouse, and you just need to do whatever it needs to be done.
He did research and he spoke to everyone that was providing care for me and asked questions.
I chose to limit the number of people I told. I obviously told my family, my brother, and since Mom had had breast cancer, I just said to him, what would you think if I said to you, like mother, like daughter? And he said, you have breast cancer and you're going to die. I said, well, you're right with the first part, but not the second.